Are you scared of ingrown nail surgeries? Well, you know what? You might not even need it.
Before jumping into procedures, doctors can do some conservative treatment for you in their office. We're gonna explain to you exactly what are those options and tell you if you're the right fit for it. Hi, I'm Dr. Richard.
And I'm Dr. Blanchette. We're both board-certified podiatrists and foot and ankle surgeon.
Today's video is different than what you usually see because we give you different options that are not surgery and not at-home remedies.
Make sure you watch the whole video and stay until the end because some of those options may surprise you.
Who is a good candidate for conservative treatment? Well, usually we recommend those for patients who have mild to moderate ingrown. So that means that you have a little bit of swelling, redness, tenderness. Even if you have a little bit of pus, you can also be a candidate for that.
There's a lot of patients that are actually scared of needles, scared of procedures, and then they've seen things online and they don't want to go to the doctor because they think that's the only thing that can be done for ingrown nails. Well, fear not. There's a lot of different options and we'll go over all of that today. Number one is a procedure called a slant back. Majority of the time, this does not require local anesthetic. And basically, it's to remove a little piece of the toenail at the edge of the nail.
It is done in the office. That's not done at home. And what we're gonna do is we're gonna remove a spicule of nail. Sometimes when patients cut their toenail, they leave a little spike behind. By doing a slant back, we're gonna remove that.
And the difference also between that and a partial nail avulsion, like I said, there's no anesthesia, and then also it's where we go. So we don't go all the way down to the root of the nail because that would need anesthesia, but we go enough to really decrease the inflammation. So why they work well is because it decreases the catch-22 of the swelling, the ingrown nail, the swelling, the ingrown nail. It gives some breathe room to the skin to kind of, decrease the inflammation, deflate, to move forward with the healing.
With slant back, I also recommend some topical antibiotics, which brings us to number 2. So which one do you prescribe usually?
I usually will prescribe mupirocin if I have a patient that has an allergic reaction to Neosporin or anything that's over the counter.
One topical antibiotics that works really well, it's actually eardrops. I know it sounds weird that a podiatrist would prescribe eardrops for your feet, but they work amazingly. They have 2 antibiotics and a steroid, so decrease infection and decrease the inflammation.
Yeah, and it's nice because you apply just with a little dropper and then right onto the affected area.
Number 3 is oral antibiotics. This one is prescribed when the infection spreads out a little more. So my rule of thumb is when the redness, swelling, warmth past the IP joint. So that's kind of that line that you see on your big toe joint. When it past this area, it starts to going towards your foot. Maybe it's time to take a pill.
The type of antibiotics is gonna vary because there's so many different antibiotics. Usually we're gonna have something that's gonna cover gram-positive cocci, which are the most common organisms that are found onto the skin. And then there's different ones that you can take multiple times a day versus 1 time a day. I really like to use cefadroxil. So cefadroxil, basically, it's a cephalosporin, and then you take it once a day compared to Keflex, which is used
2-3 times a day.
Oh yeah, it's like prescribed so often by like urgent cares and things like that. But then patient compliance is less because you have to take it so many times a day. Very
important, if you have any allergies, mention it to your doctor. Additionally, if you have diabetes, usually we're gonna prescribe something that has greater coverage, not just the gram-positive.
If you have any history of MRSA, so methicillin-resistant Staph aureus infection, the cefadroxil or the broad-spectrum antibiotics is not going to cut it. You're going to need something that's going to be specifically against MRSA. Usually it's doxycycline or Bactrim.
Number 4 is nail bracing. So this is the one that surprised a lot of patients.
Yeah, so we're not talking about a foot brace. We're not talking about teeth bracing. We're talking about toenail bracing. Yes, exactly. And this is really nice little thing that we can do. So basically it's a band of usually plastic that's gonna want to coil back to being straight. And this is gonna be applied at the tip of the toenail, wherever it's growing to your skin. And it's gonna start to recoil the nail back up, and it's really going to help to decrease that pressure at the tip of the toe.
Number 5 is Onyfix. This one is better for a patient who has really pincer nails, so that anatomically nails that are really, really curved.
It's a little bit different than the bracing because it's not a plastic piece that you're gonna put on it. It's actually a resin that you're gonna be applying at the base of the toenail. And this is gonna work very well for people that have the normal anatomy of the toenail
At the base?
but then very curved at the top. I have a patient one time, she came and then her toenail was literally like this. It's like a little shoe horse. And then even if I wanted to do a nail procedure, I would have to remove so much of the nail and the nail would not look nice after. It would be like so narrow. We did Onyfix and she had amazing results. Onyfix is gonna be done in the office. We drill a little bit of the toenail at the base to make it a rougher texture. We're applying a bonding agent, let it dry, and then we're gonna apply the resin and we're gonna cure it with some UV lights. You have to keep your foot dry for about 24 hours to make sure that it's gonna stay properly. The band usually needs to be changed every 3 months, so it's a longer process because basically you reshape the nail as it grows. But I've been having really, really great results with that.
Let's see a before and after picture.
Look at that, that's amazing.
That's amazing. Quick pause. If you're finding value in this, please like, subscribe. It really helps us sharing evidence-based education.
Number 6 is custom orthotics. I know this sounds weird because you're like, how will an insert or an arch support on my foot help my ingrown nail? But this is actually really interesting for people that have overpronation when they step and then their foot collapse down, their arch collapse. It puts a lot of pressure at the tip of the toe.
There's also other biomechanical issues that orthotics can help. So if you have hallux limitus or hallux rigidus, that means that your big toe joint that doesn't have enough range of motion. So it's gonna stop, and guess what? The next joint over, it's gonna compensate. So this one is gonna lift more and it's gonna rub more inside your shoe, creating more risk of having ingrown toenail. So we can correct that also with a custom orthotics. Number 7 is fungal toenail treatment. If you have a fungus on your toenail, the nail will be thickened and it can also change the shape. So it puts you way more at risk of developing an ingrown toenail. First things first, we don't recommend you to try to treat that at home because in the office, we want to do what is called a nail biopsy to see what's going on with your nail, to see if there's actually a fungus growing before we start treatment.
Thick toenail, maybe from fungus, but they can also be from a lot of different things like psoriasis and things like that. And that's gonna be for a whole other video.
Usually there's topical, oral, or even laser treatment to get rid of the fungus.
When surgery is actually needed. So we give you a lot of things that we can do in the office conservatively to help with your ingrown nails. But unfortunately, sometimes people come and see us and it's far gone and we can't really do anything else than to do a surgery.
Procedure. When my patient have a pyogenic granuloma, so it's a little piece of skin that bleeds really easily, that's on the side of your nail. When you have that, conservative treatment usually doesn't work.
To have failed the conservative treatment, or if you always have recurrent ingrown toenails. So yes, we can do things that are gonna help you, but usually temporarily, and then you might benefit from having a proper partial toenail avulsion with or without a metrosectomy.
Pain should also be mentioned because sometimes I have patients that come into the office 8, 10 out of 10 pain. They don't want to do conservative treatment. They want a relief right away.
Quick fix.
If you need surgery, here's the good news. They're safe, quick, and effective.
They really work very, very well. We're gonna take a deep dive in all of the procedure that can be done for ingrown toenail, all the surgeries, in the next video.
If you're dealing with an ingrown toenail and you don't want a surgery, don't wait too long because the conservative treatment work best when done early.
And we also recommend to couple them with home remedy. And if you want to know what to do, watch our previous video on home remedy for ingrown toenails.
See you next time.
Bye.
Ciao.